We're hearing not great stories from counselors and teachers and parents saying that children are not adjusting. There's high levels of anxiety. There are just issues that really are hitting primary students more than anything. What is your take on that?
Yeah, I find that very interesting because that's not what I'm hearing across the board. We certainly know that there was a lot of stress on families across the board when schools were closed, and that was one of the reasons why we focused so much on making sure that we could work together to keep schools safely open. And as you know, here in British Columbia, we had schools going back full time in June of 2020, and it was through the efforts across the board of parent groups, of teachers, of superintendents, and the principals and public health working together to make sure that we had that structure there for students. So, what I'm hearing is that absolutely, I mean, everybody has experienced a lot of changes and anxiety and uncertainty over the last 3 years, but that students are adjusting, and some of the supports that we've put in place in classrooms are really helping that. And we're seeing some improvement in some of particularly the anxiety and depression that we saw when children were out of that structured environment. We've been working with the school districts across the province, and there is mental health and emotional support teams, and there's been a lot of work done in the school districts to look at what are the needs within each different school district. So they're all slightly different, but public health has been working very closely with each individual school and school district to look at what are the supports that are needed.
Where do you think this is coming from then? Because we have a lot of people who are saying the complete opposite of what you're saying, that things are not all right. Kids are really struggling with impulse, with emotional learning curves, with anxiety, with depression, et cetera, and that there are no resources to help these students. So, what's going on here?
Yeah, so I'm not sure who you were talking to, but there are, of course, families that are struggling. There are children that are struggling. And across the board, though, the important thing from a public health perspective is having that structured environment where there is a safe place for kids. We know that school is much more than book learning. It's about developing those social, emotional connections, having a place where you can talk to, having that social connectivity, having a safe place. And for many children, it is a place where they get a meal in a day. So those are all things that we've ensured have been in place over the last 3 years. And in different schools, there are different support programs for the families depending on the needs.